Hi guys, welcome back to my channel. My name is Kaso. If this is your first time coming across my channel, you are highly welcome, and please do not forget to hit the subscribe button. And if you are my OGs, you already know yourselves. Thank you for watching my videos. I really appreciate it. We are already in 2024. Wow. Happy New Year to you guys. I'm so excited. So 2023 is now a past tense and was indeed a wonderful year, and I'm so happy to see you guys again in this 2024. Some people didn't get to witness this new year, but we are here in a healthy mind and body witnessing this new year. 2023 was indeed a wonderful year, and we pray that 2024 will be far more better than 2023. As you can see, I'm putting on my nursing uniform, and you guys already know that whenever I put on this uniform, I am strictly here for business and to pass an important message. So this is my first official video of the year, and it is all about nursing. Wow. So in today's video, I am going to be unraveling the content in the CHN bag. This is the CHN bag. So this video that I'm about to do now is dedicated to someone out there who has the vision of pursuing a career in nursing. I did a video last time about the 5 nursing essentials you need as a nursing student, and in the video I mentioned about the OB bag, but I didn't get to review the content inside this bag. So if you haven't watched the video of the 5 nursing essentials you need as a nursing student, I will be leaving the link in the description below, so you go and watch it and know the 5 nursing essentials you need as a nursing student. So this is the CHN bag, and you can also call it OB bag. So this is the bag nurses use to render community services. So this bag is of 2 types. We have the sling type and the square type. So this one you are seeing now is the sling type, but the square type, the picture is above the screen. You can see the picture of the square type. So if you want to see the square type, you can find the square type at the health center, the clinic, or the hospital. This bag is considered to be sterile, meaning that it should be handled with care and should avoid any form of contamination. It should be kept in a clean area. In nursing school, you will be taught a procedure known as the bag techniques, and in that procedure you will learn how to properly use this bag and also to render an effective nursing care to your client. So this is CHN bag. CHN bag, the full meaning is community health nursing bag, and you can also call it OB bag, and it is one of the essentials you need as a nursing student. And remember that nurses use this bag to render services to the community. Stay tuned and let's unravel the content of this bag. So this is what the inner part of the bag looks like, and I'm going to unravel the content inside this bag, and we are going to start from the top part of the bag, which is here. So the first item is the gauze swabs, and this is what the gauze swabs look like. So this item is used for cleaning and covering wounds, meaning that it is used in wound care, and it is also one of the contents of the CHN bag. So this is considered to be sterile, meaning that it should be used only once, and if the color changes to yellow, you have to discard it at once. So it is sterile and considered to be used only once and not twice. We have the cotton balls. So this is the cotton balls. I believe you all know what this is used for. This is used for, cleaning wounds, dressing, and so on. So this is cotton ball, and it's also one of the contents of the CHN bag. So the next one is the syringe, the disposable syringe, which is considered to be used once. So it's also one of the contents of the CHN bag. As you can see, I have different sizes of the syringe. I have the 5 ml, I have the 3 cc, the 2 cc, and like the 1 ml as well. So syringe is also one of the contents of the CHN bag, and also it is used in rendering effective nursing care to your client, in case if your client needs an urgent injection or something. So you have to make use of the syringe to render the effective care to your client. We have the kidney basin. So this is the kidney basin, or you can also call it an empties basin. So this is what it looks like. So this is used to render nursing care to an unconscious patient, especially if your procedure is to do oral care. So this is MC's basin, and it is used for oral care when your client is unconscious and cannot be able to brush his or her teeth. You have to make use of this to collect the fluids coming out from the mouth. So this is MC's basin, but you can call it kidney basin, and it is one of the contents in the CHN bag, the MC's basin or the kidney basin. So we have the thermometer. I believe you all know what thermometer is. So thermometer is used to check the temperature of your client. So this is thermometer. So you first have to clean it and then insert it at the axially region of your client, then put it on, then allow it to beep, and then you remove it. So when it beeps, you check the temperature and then inform your client about his or her temperature. Ma'am, sir, your temperature is 36.6 degrees, which is normal. Another one is the tape measure or the measuring tape. So this is also one of the contents of the CHN bag. So the measuring tape is used to assess a pregnant woman or to perform what we call Leopold's maneuver. So this is used if your client is a pregnant woman, you have to measure the fundic height. So that is the use of this measuring tape. It is used to measure the fundic height of a pregnant client. Then we have hydrogen peroxide. This is hydrogen peroxide, and this is used for wound care. So if your client is a client that has a cut or wound, you have to make use of hydrogen peroxide to clean the wound, and it is one of the contents of the CHN bag. We also have iodine, which is also antiseptic or disinfectant, which is used for wound care or cleansing of the wound. So this is iodine, and if your client is also a person that has cut or wound, or a client that needs a wound care, you can make use of the iodine to clean the wound and to cleanse the wound. Then we have the pen light. So this is the pen light, and this is used in performing an eye assessment, or if you want to check the mouth of your client, you can check the mouth or the side of the mouth using a pen light. Or if you're also performing an ear assessment, you can check the tympanic membrane with the pen light. So the use of the pen light is to help you to see something that you cannot easily see. We also have bandage scissors. So this is bandage scissors, and this is used to cut plaster or bandage as well. So you can make use of these scissors to cut your plaster or bandage, and it is also one of the contents in the CHN bag. We also have plaster. So this is plaster. Maybe after giving a client an injection, you have to use cotton balls and plaster to put at the area of injection to avoid bleeding or something. So this is plaster, and when cutting the plaster, you make use of the bandage scissors to cut the plaster. So this is what plaster looks like. Then we have pulse oximeter. So what is the use of this pulse oximeter? This pulse oximeter is used to check the pulse rate and the oxygen saturation of your client. So this is how to make use of the pulse oximeter. You ask your client to put the index finger, then you put it on and allow it to read. As you can see, it's reading. So let me know my pulse rate. So my pulse rate is 90 and my oxygen saturation is 96, which is normal. So this is pulse oximeter, and it is one of the contents in the CHN bag. Nursing is all about prevention and promotion of health. So as a nurse, you have to safeguard yourself from any infection, any form of infection. So this hand glove serves as a shield to prevent any form of infection to enter your body. So this is hand glove, and it is used in the nursing field and also while rendering services to the community or to your client, and it is one of the contents in the CHN bags. We also have the umbilical cord clamp. So what is this used for? So this is used to, after the newborn is being delivered, you have to make use of this cord clamp to cut the cord of the newborn. And note that the cord clamping is done within 1 to 3 minutes, and you cut the cord when the pulsation has finally stopped. So this is cord clamping, and it is mostly used during in the delivery room or when a pregnant woman have delivered her baby. So that's all for the contents of the CHN bag. You can see that the bag is already empty and there is no other item in this bag. But before we round up this video, there is one more content that is not in this bag. It's also one of the contents of the CHN bag, but it is considered that the contents or the items should not be placed inside the CHN bag. And what item are we talking of? BP apparatus. So the BP apparatus is also one of the contents of the CHN bag, and this should not be placed inside of the bag. And I could remember in the last video I did, in the 5 nursing essentials you need as a nursing student, I also mentioned the BP apparatus. Like I said earlier, if you haven't watched the video yet, I'll be dropping the link in the description below, so you can go and watch the video and see or know the 5 nursing essentials you need as a nursing student. So this is BP apparatus with the stethoscope, and it is one of the contents in the CHN bag. But remember, it should not be placed inside the CHN bag. It should be placed outside the CHN bag. So guys, this comes to the end of this video. If you love what you watch, kindly hit the subscribe button. Also drop a comment under the comment section, and share this video to someone in your family who wish to pursue a career in nursing. Happy New Year to you all, and to the incoming nursing student or someone who wish to pursue a career in nursing, I wish you the best of luck. Nursing is fun and at the same time educative, regardless of the stress, but you're gonna enjoy it. Thank you for watching, and catch me up in my next video.